Hello everybody, I'm going to show you today that how and why we do DISE procedure, which is called drug-induced sleep endoscopy. So when a patient comes to us with snoring, first we try to understand whether it is a simple snoring or it is a disease called obstructive sleep apnea. There are many ways to differentiate from clinical symptoms, from sleep study and also from the DISE. So the patient is taken to the OT and we make the operation theatre something like a bedroom, like the lights will be dim and as far as possible we maintain the silence, and then our anesthesia doctor gives IV medication like an injection, not to make them unconscious but just to make them sleep, which is almost very near and close to the natural sleep. Now, as the patient sleeps here and he or she starts snoring, then I keep a look at the monitor, which is the anesthesia monitor, which can show us how is the oxygen saturation, is it maintaining at 97, 98, or is it coming down below 90. I also observe the patient's chest movement and how the airflow is happening through the nose. That tells us whether the patient is having apnea or not. Apnea is stoppage of respiration for few seconds, which is dangerous for our heart and brain. Now, when the patient is snoring, I put the endoscope, which is a very fine 3 mm scope, not painful at all, and it doesn't disturb the patient's sleep. So this is something like a real-time viewing what is happening in the nose, in the airway during the patient is snoring. So how does it help me? It helps first to corroborate with the sleep study, whether whatever report came in the sleep study, it is correct or not. Number two, what should be the best treatment plan for the patient, CPAP or surgery or dental device. And number three, if the patient opts for surgery, the patient doesn't like the CPAP, what particular surgery will give the best result. Thank you.